You experience a lot of uncomfortable symptoms after eating? Do you get gas and bloating fairly quickly, so you start thinking food is not my friend? If so, this video is for you. Hi, I'm Dr. Richard Matthews. I'm a board-certified chiropractic neurologist, and I do a lot of work with the gut and gut bacteria. Today we're going to talk about a problem called SIBO. And in this video, we're going to talk about what is SIBO, the symptoms of SIBO, testing for SIBO, and treatment for SIBO. Now, SIBO stands for small intestine bacterial overgrowth, and this is just a research paper going through a lot of the facts published on National Library of Medicine. Useful place if you want to find information about things. So it's defined as the presence of excessive bacteria in the small intestine. And this is important to notice, and notice the name is overgrowth. It's not infection. It's a distinction really that means these they're not necessarily pathogenic disease-causing bacteria in themselves, but they're excessive bacteria growing in a place where there should not be much bacteria growing. So when you look at our digestive tract, we've got mouth, esophagus that goes down to stomach, and then small intestine that goes to large intestine, that goes to sigmoid colon and out. What we're talking about is that most of the bacteria should be growing in your large intestine where your gut microbiome lives. Trillions of bacteria, billions of bacteria. When those bacteria move upstream and they start growing in the small intestine, even close to the stomach or even in the stomach in some cases, we call that small intestine bacteria overgrowth. Now, this causes problems because the small intestine doesn't have room for all that, and it's not evolved for that. So when you get bacteria there, as soon as you eat something that feeds those bacteria, poof, you get a bloom of bacteria and a great production of gas, and your intestines want to blow up like a zeppelin and cause you a lot of pain. It's a bad thing. So we want to prevent that, and there are a lot of different causes. You can look at this pretty extensive list and see there are a lot of causes and associated issues. We can go through a lot of those in other videos, and some of the blog posts that I've done address that. For the moment, we're going to talk about the major parts of the topic, and there are really a couple of major reasons that you can get SIBO. One is that your digestive tract doesn't move things along fast enough. This is called motility, just like mobility, but with a T instead of a B. It's defined as how well your intestinal tract moves everything along. If it's too slow, bacteria can kind of swim upstream or just colonize farther and farther upstream. Now that can be caused by stress. It can be caused by an imbalanced autonomic nervous system. Those are probably the two biggest causes. In some people, it happens because of age, which really makes your autonomic system imbalanced. If you're not aging gracefully, it becomes more and more challenging to keep your autonomic system doing what it should be. And that's the system that powers your digestive tract. Now, when we look at what SIBO is, how we test for it, and so forth, it's tested by actually looking at what gases you exhale. So the symptoms of SIBO: belly pain, queasiness, bloating, uncomfortable fullness after eating, loss of appetite, indigestion, a lot of gas, fatigue, weakness. Part of what differentiates this from a problem with your gut bacteria in your colon, what we would call dysbiosis, is the timing, because food doesn't get to your colon within the first 20 minutes, 30 minutes after you eat. It's not there yet. So if the reaction is happening within 30 minutes, it's much more likely that SIBO may be causing the problem because, well, that's where the food is. And this is just from WebMD here, some basic information. It's possible to also have a fever from SIBO, And that's because when the bacteria are there, a lot of them die, and they release particles of bacteria that are known as lipopolysaccharides, or LPS. Now, this is an endotoxin. It's actually used in some types of lab experiments because it triggers a flu-like illness, including fever. And if you have too much of it happening in your intestines, you basically absorb some of those into your bloodstream, and your immune system reacts to it, which is a bad thing. There are devices that we can use to test for exhaled gases. You keep track of your foods, or you eat specific ingredients, powdered samples, and gases are produced, and then you do a breath test, and that shows you what the gases are. So this is one of the things that is useful for this type of testing. Now, we can also consider what to do about it. And the standard for treatment apparently is an antibiotic called rifaximin, even though technically rifaximin, at least as of this date, which was 2014, was not actually approved for that. It's still what was commonly used for it in the United States. And here's the dosage that was used, 1,200 milligrams a day for 10 to 14 days. And when you look at that, one of the things these researchers talked about is that rifaximin is actually pretty expensive. It's, back then at least, it was as much as $1,247 a month, and even a Medicare copayment would have been $638. And what these guys did, these researchers, is that they compared the efficacy of this antibiotic with using natural herbal and essential oil products. And we have some of those products on our online store. There's nothing really hard to get there. And what they found is that it worked really, despite the title that says it's equivalent, it actually worked a little bit better. They found that in our study, we demonstrated 46% of patients normalized their lactulose breath test, the breath test you use for this, with herbal therapy. And they say there's no statistical difference, but rifaximin resulted in 34% improvement in their tests. I'd rather go with the 46 if it's me. Statistically, it's because they had 104 patients in this study. So it's not a huge study. But in any case, they said it's at least equivalent. It looks like it might very well be better. If they had a larger sample size, they might have been able to make that claim. They even went back and did a crossover part of the study where they took some of the patients who were non-reactive, the rifaximin non-responders, and they gave them the actual herbal treatment. And they found that they improved as well, even though they had not improved with the antibiotic. So really, this is not intended, it's not shared here just so that you quit your doctor's advice or something. The disclaimer is this is not intended for medical advice, but it's for your learning so that you learn how things work. I've always believed through the course of 32 years of private practice that the best patient is a well-informed patient, so I do everything I can to share information. And hopefully, patients can share that information with their physicians, and their physicians can also make the best choices based on all the information available. For example, if the patient cannot afford rifaximin, what are you going to do? So there are also diets. There's something called a low FODMAP diet. I'll be doing another video on that as well. And the low FODMAP diet means to avoid a number of fermentable fibers. So in summary, there are many, many factors to consider, but what we reviewed is how SIBO, what is SIBO, what are the symptoms, what do we do testing for it, And what do you do to intervene to get better from it? There's a lot more information necessary for you to make use of this, I realize. In the future, I'm going to be doing a video on testing for SIBO. Hopefully, I'm going to be evaluating some of the testing products that are available so I can do a review of those and demonstrate them also. And I'm also going to do a review of different types of diet, like a low FODMAP diet, and how you could implement that and why you would implement that to help with SIBO. And probably also do one on some of the other causes, maybe stomach acidity, for example. More on that later. If you like this video, please click on subscribe, give me a thumbs up, it really helps. And if there's anything that you'd like me to do a video about and share some information, just send me a message or leave a comment in the comment section. Thank you. Be well.